hearty greetings. Welcome to Head Plus. I am Nsa Yakubu. Let's begin with a review of last week's episode.
You give birth, the idea of locking everywhere, shutting out the light is not the best. You may not see the skin color of your child. You know, this issue of we not want make breeze enter a body, so they will lock the windows, put curtains, everywhere will be dark. It's not right. You should be able to inspect your child's skin every morning.
Today, emphasis on hemophilia. Simply say a rare bleeding disorder that leads to hemorrhage in various body parts. Yes, you heard me right. Details after the break. We'll be right back. Thank you indeed for staying with Head Plus. Now, hemophilia is a lifelong inherited bleeding disorder. Today, we shall x-ray the prevalence, causes, types, symptoms, diagnosis, and treatment. Our guest today is Professor Omolade Awodu, a professor of hemophology and consultant hematologist. She takes it from here.
This disease is passed on through the gene that we call the S chromosome, and the woman has this in double portion SS, and so for a defective S chromosome of that protein, if it is defective, if it's carrying that gene, we say it's defective, has hemophilia gene. So the other S kind of protests in terms of secreting these clotting factors. Hemophilia is one of the inherited blood disorders and is commoner in boys, but these days we are seeing that girls also have symptoms. In those days we used to say women are carriers, that is, they transmit the disease to their sons, but now we are seeing women that are also carriers. And the theme for this year's World Hemophilia Day is Access for All. Women and girls bleed too. And the reason for that theme is that it's been noted over the years, and then researchers have also seen that women are also bleeders, but they kind of bleed silently for fear of stigmatization. And so they are underdiagnosed and they are underserved. And by that I mean that they now don't have access to treatment because they are not diagnosed. So part of the activities for this year's World Hemophilia Day is actually to sensitize the community and the general public to know that women also bleed and girls also bleed. And apart from hemophilia, there's another bleeding disorder known as von Willebrand's disease. This disease actually is the commonest bleeding disorders in women and men, but it's usually downplayed because we do not have the diagnosis. Now, why do we say that women also bleed and girls also bleed? We know as women, we know that quite a number of girls, they have excessive menstrual flow, which in medicine we call menorrhagia. And some of them, they have taken it as it's in my family. My mom has it, my sister has it. And so they don't appreciate it as a kind of problem, and they continue to live with it. Some girls miss schools when they are in their period. And so with these frequent reports, the attention now is tending towards recognizing that women also bleed and girls also bleed as well. Basically, we have three types. We have what we call the hemophilia A, hemophilia B, and hemophilia C. Now, the one that is of concern, all of them are inherited, but they can also be acquired. The one that are more of concern to us are the hemophilias A and B. And the difference is in the type of protein. We call them clotting factor. That's the factor that helps our blood to clot when we have injuries. So this clotting factor 8 and 9, the hemophilias, they have them in very, very reduced quantity. Okay, so if, and they are numbers from 1 to 13, and the one that is hemophilia A is when that protein factor 8 is deficient, that's A. Then the B is when factor 9 is deficient, that is reduced in the body. And the how they present, that is the symptoms that they display, they are actually the same. Until we do the test in the laboratory, we will not know whether it's B or A that the individual has. But however, because they are inherited diseases, so if a family, we already know that in this family there is hemophilia A. So if there is not a baby now that is coming, we know definitely the baby is going to have hemophilia A. So it is inherited. Hemophilia is an inherited blood disease, and we can the girls, they usually are carriers because, but like I said earlier on, they can also bleed as well. But majority of the carriers, they will not bleed, but we are beginning to see carriers that bleed. And this disease is passed on through the gene that we call the S chromosome, and the woman has this in double portion SS. And so for a defective S chromosome of that protein, if it is defective, if it's carrying that gene, we say it's defective, has the hemophilia gene. So the other S kind of protest in terms of secreting these clotting factors. So that's why women don't tend to have the disease more than as the men. So but men have just one portion, and that S, if they usually we get from their mother. Okay, so the Y they get from their father. So anytime they get the defective X from their mother, then the boy will manifest the conditions. However, we've noticed that the quantity of that protein that is produced, remember, they help us to prevent clotting. Okay, so if the amount that is produced is less than normal in females, they too can bleed. And hence the theme for this year, that girls and women bleed too. So they can also manifest, come out with bleeding. So the concept that females are just carriers is no longer entirely true, because they can also bleed. Okay, so the symptoms depend on the severity. So for the very severe type, the symptoms can start even from birth. Okay, so if the child is born through the vaginal delivery, even the pressure of the baby's head on the birth canal can elicit symptoms. So the baby can start bleeding underneath the head. So you have swelling in the head. And then if that doesn't occur, when the baby is circumcised, usually in this our environment, we know that within the 4 weeks, basically the first week of life, they usually will circumcise the baby. So when the baby is circumcised, they can come up with what we call post-circumcision bleeding, and that is actually one of the things that will bring the mothers to the hospital. So these babies start bleeding when they are circumcised, and the bleeding is not stopping, unlike the other one that after applying the pressure and all that it will stop, but it's continuing. it is uncontrollable bleed. So that's one of the symptoms. Then as the baby also begins to grow, because of pressure, and it can begin to bleed into the joint, into the buttocks. When they are sitting, they have a fall, they can bleed into the muscles, okay, and then they bleed into their joints. They can also bleed even into the brain, but thankfully enough, that is not so common. And the female persons can have that menorrhagia, excessive menstrual bleeding that I mentioned earlier on. And as they begin to bleed into the joint, the blood is irritable to the joint. So it begins to cause a kind of inflammation in the joint. And over time, the joint can become stiff, and these babies they have joint deformities, and they will not be able to bleed properly. So I have this example. This is this is a hemophilic boy now that has been bleeding into the joint. You see the swelling. So they can come up with painful swellings in the joint because of the bleed in the joint. Okay, so they begin to have this. They can also bleed, they can bite their tongue and then they bleed. So they can have bleeding from biting of the tongue. And then when they have problems with their teeth and they go to the dentist for dental extraction, they can also bleed excessively during the dental extraction. These are just some of the symptoms of this condition. If one notices that you have a child that has repeated swelling in the joints, maybe after, depending on the severity, for the severe types, they may not even have any fall and anything. We call it unprovoked bleeding. So the bleeding can just start spontaneously. And a mother that notices that, or a father, should report to the hospital and let the doctor know that, at least for checkup and for diagnosis, to be sure this is not it. And then women that are having excessive menstrual flow, they should not just assume that, oh, it's my mom has it or my sister has it, and so it is normal. So the more reason they should come up to check and be sure they do not have a bleeding. For diagnosis, history is very, very important, and because it's inherited, we have to take a very good family history. So we want to know if they have uncles that have been bleeding, if there are other siblings that bleed, and the mother herself, if she has excessive menstrual flow. So we start from the history, take good past family history, as well as what we call a past medical history. For the past medical history, we want to know the circumstances around the birth, whether there is any bleeding issues with the baby during the umbilical stump, whether there is excessive bleeding with it, and then whether there is post-circumcision bleeding. So we start with history. So once we have this history and they are positive, our suspicion of hemophilia is very high. So we take the blood samples, and thankfully enough in UBTH now, we could make diagnosis. So we do the different lab tests, and then we are able to confirm that the patient has like I said, it is a clotting factor that is deficient in the system. And so the treatment is easy. Easy in the sense that you just replace what is not there. It's like somebody that is hungry and you give the person food, and that is it. So we replace this clotting factor, and that is where the easy treatment stops. The big challenge is, in Nigeria, we still depend on 100% on donated factors through an organization we called World Federation of Hemophilia. And that organization was started by a man, Frank Schnabel, who had severe hemophilia, and started the organization to raise up awareness and donations. So we Nigerians are benefiting from that. So we get these factors from them, and then once they come up with bleed, we give them the factors. This is one of the complications. The joint becomes severely deformed, can get to the extent that the patient may not be able to use the joint, and of course they can bleed into the brain, and if they bleed into the brain, they could have some neurological deficits that either that they may not be able to walk properly, or they can have something like stroke, and then they may even die from that condition. So these are the some of the complications. And in those days, before we start having what we call recombinant clotting factors, they can, because it's blood products we give them, so they could also come down with infections that are transmitted through blood products. But that is no longer the case now, and HIV was one of them in the early 80s. But right now, the products are well treated, and some of them are actually genetically engineered, so there are complications. Yeah, so that's another challenge, because the awareness is poor. Many persons suffer silently. So worldwide, it's supposed to be like 10,000 life members that have hemophilia. Okay, 1 per 10,000 life members. And so if you work that out by Nigerian population, so we should be expecting that in Nigeria we should have up about 15,000, between 12 and 15,000 persons living with hemophilia. However, right now in the Hemophilia Foundation of Nigeria register, we just have about 1,000 persons registered. So you could see that the rate of diagnosis is still very, very poor. So for Benin City in Edo State, Delta, we cover Edo Delta. So in our register presently we have 38. And in recent time we've been increasing awareness, and I must thank NTA for airing this program, because this year alone we have diagnosed 8 fresh cases of hemophilia. There is actually a marked effect on the quality of life. So you can imagine that you can just have a spontaneous bleed, and for the children, they miss out on schools, and for the adults, because of the repeated joint bleeds, they develop joint deformities, joint pain, so it affects their ability to get good jobs and all that. So overall, there's a study we just concluded recently, and it actually shows that most of our patients do actually have a low quality of life. However, like I mentioned, that the product is available in developed countries. They just give what we call prophylaxis, the factor to prevent bleed. So they have a minimal level that can help them to cope with any injury or prevent spontaneous bleeding. But because we depend on donated products, we do not have enough. We do what we call on-demand treatment, and because of that, some of these patients, when they bleed, they could develop complications and all that. So those also impact on the quality of life of these patients. Definitely they have very low quality of life, but in developed countries, quality of life is much better. Life expectancy is also much better, because the factors are available, and the government takes over the factors, the treatment of these patients, because it's a chronic illness, it's a lifelong ailment. So it's not what an individual can do. So government needs to take over the treatment of such patients, and with that, the quality of life will improve, and the life expectancy for them will also improve as well. If a woman is pregnant, thankfully enough, it's not as common in females, like I said earlier on, as in males. But if we have a female hemophilia, the the good thing is that this protein, one of the proteins, especially the factor 8, the level increases during pregnancy. Again, that's God's way of protecting women from excessive bleeding during delivery. So the increment will be able to kind of produce a balance between bleeding and clotting at the time of delivery. Okay, so that takes care of that. But if the level is very low, the increment will not be able to account to protect the woman. So in that case, we now have to be given the factors, and then at delivery the factors need to be given. Post delivery the factors need to be given as well. So we just give the factors if they are not contraindicated during pregnancy. So we just give, especially around the time of delivery.
Professor Awodu continues from here.
So to the public, hemophilia is with us, and we should have this index of suspicion. If you have children that bruise easily, children that bruise easily, and then girls that have excessive menstrual flow, and we should know that we should see our doctors. And then diagnosis is also with us. Most of the teaching hospitals, they can't diagnose, especially here in UBTH. You can diagnose at very, very, very affordable cost. And of course, treatment also is available. Unlike before, that is blood transfusion we use. So for the public, it is not something to be ashamed of. And if you have reasons to think that you may have a bleeding disorder, please consult or come to the hospital. Request, depending on the age of the person, request to see the hematologist if it's an adult, or a pediatrician if it's a child.
Obohian, otherwise known as Waka.
This is Head Plus. Today, searchlight on universal health care. What does it mean, Fatal?
It's good to sing praise unto our God, for it is pleasant and praise is comely.
Hello and welcome to another exciting episode on Youth Arena.
Hey there, welcome to another exciting episode in Top 7 Jams. It's your girl Pearl. You are watching NTA Benin, Channel 7. For your breaking news, program sponsorship and participation, contact our marketing department. Follow us across our social media pages on Facebook, NTA Benin 1, on Twitter, NTA Benin 1, on YouTube, NTA Benin.
Quick reminder that you can watch us on all our social media platforms showing on the screen right about now. Okay, as we conclude today's telecast, do adhere to the doctor's advice as always. My name is Msa Yakubu. Thanks for watching today's episode. See you.